Good afternoon, everyone. Welcome. I'm really happy to greet you for this side event, Gaza Explosive Hazards in the Early Recovery, Integrated and Coordinated Approach. My name is Katerina Templeton, and I'm an Action Area Responsibility Coordinator for Occupied Palestinian Territory. And it's my honor today to moderate this discussion, which is going to be really interactive and insightful. And today I'm joined by excellent colleagues, professionals who are going to provide us the insights of the Gaza reality, operations on the ground, on how coordinated, integrated approach supporting other sectors. So today we have Mr. Glenn Darian from Humanitarian Inclusion, Regional Violence Reduction Specialist. We have Mr. Julius van der Wald, who is the Chief of Main Action Program for Occupied Palestinian Territory from UNMAS. We have Sigolene Laubert, Donor Relations Manager from Hello Trust. We also have Colin Band, Global Special Advisor for conflict preparedness and protection from Norwegian People's Aid. And we have Nick Wolf, Humanitarian Disarmament and Peacebuilding Manager from DRC. As we look toward early recovery, I think it's important to keep in mind that explosive hazards, they still pose the most significant risk in this context. The explosive ordnance, it's not only legacy of this conflict. Unfortunately, this is the threat which still poses the significant risk to civilians, to infrastructure, to early recovery efforts. And mine action is in Gaza, not anymore the standalone activity. It's very much a critical enabler which helps any other sector, health, security, food security, education, to enable them to do the humanitarian aid. Today's discussion is going to be focused very much on the how integrated approach help enable other activities, how we can better integrate mine action activities in the early recovery efforts and frameworks. And we're going to discuss also how mine action activities can help civilians. So without any further delay, I would like to start my conversation, and I encourage everyone to participate actively in this discussion. So my first question would be to Mr. van der Wald. Can you please help us better understand the reality of the mine action operations on the ground, and also how UNMAS is responding currently to their needs?
Great, thank you very much. I think let's start with a small video, just quickly to give an overview of what it looks like in Gaza at this time.
مفكرها مفجرة وعادي فيش فيها شيء. أول ما جبتها حطيتها على الأرض انفجرت.
The full video is of course available online to view. And I think the most important thing is to understand that mine action in Gaza and the overall situation, the humanitarian situation in Gaza is quite unique. When we look at the recent published, it was the EU, the UN, as well as the World Bank issued the RDNA, the Rapid Damage Needs Assessment, which has three key figures that we need to identify here as well. First and foremost, in Gaza, out of a population of 2.1 million people, 1.9 million people have been displaced. Several of them have been displaced repeatedly. 1.2 million people, as per the report, have lost their homes. That accounts for around 60% of people losing their homes. The human impact, where they say people have been set back 77 years, as per the report, and that's the reality on the ground. That is what we are seeing. You can see the response that we have, and all of these things that we are ultimately talking about when the report reads that it's going to take decades for the reconstruction. This is compounded by, of course, the explosive ordnance threat in the context of Gaza. What we have done so far during the course of the conflict, I think it's very important to understand that we have never left Gaza. During the course of the conflict, we have been there, UNMAS with its partners. During the course of the conflict, we had the generous support of our partners, also embedding their personnel into our structures and jointly responding. It's not been mine action in the traditional sense, the classic enabler of humanitarian aid. It's essentially been the approach of mitigating risk. It's part of the risk mitigation process, and that was the nature of the mine action response in Gaza to date. This was the enabling, of course, through the delivery of explosive hazard assessments to our humanitarian partners. These are simple things, for instance, or it sounds simple, but for instance, like where WFP wants to distribute food, they would have a site, so not to present additional risk to the population, we would be assessing that. You've seen the numbers very briefly. We're around 10 or 1,000 items of explosive ordnance that we have identified so far. I think the key thing in that is to understand that this is not due to a systematic survey of the Gaza Strip. This means that in point A, we will ask for assessment. In point B, we have been asked for assessment, and we have located 1,000 items. We do not know what's between point A and point B. What this means in the geographical size of Gaza means that we are talking about explosive ordnance at least one every 6 meters. Now put that in context, if you think about the current the population density prior to the war was about 6,000 people per square kilometer. That means that now where we stand, where only half of the territory is essentially accessible to civilians, that would be close to 12,000 people per square kilometer. Imagine trying to evacuate people 600 meters to deal with an explosive ordnance. These are the realities, these are the challenges on the ground. As I've said, during the course of the conflict, UNMAS have been leading a direct implementation, which a lot of you would recognize that's familiar with the implementing modality of UNMAS, and our role in the mine action sector is quite different to what we do in other contexts. But we were there, we were delivering explosive hazard assessment interagency missions alongside our partners, facilitating entry into the Gaza Strip and assessing, the different things that we can ultimately do to enable partners. I'll use a very simple example that very recently we were supporting the World Health Organization, assessing the European Gaza Hospital, which was a case which consists of around 12 buildings. In that specific compound, the mine action work assessing the compound resulted in the explosive ordnance being identified in 2 of the 12 buildings. Yes, it's 2 buildings that's inaccessible, but it's 10 other buildings that were assessed as accessible, as safe, and that had the enabling effect of strengthening the response, where the Ministry of Health, of the de facto authorities, alongside the World Health Organization, could recover critical stores and critical equipment that could be taken to other hospitals to be used there. You would see there the oversight on where we are. Initially, some of the things that we were focused on, our interventions, which is all prioritized, looking at the food sector, shelter, wash, all those kind of things, as we move now towards a combination of humanitarian as well as early recovery priorities, which also sees in how we look at early recovery and reconstruction ultimately, which is essentially being led by our partners at WFP, UNDP with the physical damage assessment. So what you can see there and what our work has been so far is, first and foremost, we led on the coordination. And when we talk about coordination, we're not only talking about a coordination on the ground. It's coordinating here at forums like this. It's coordinating with donors, ensuring that the donor community, member states have the necessary information at your disposal to essentially be able to make informed advocacy decisions to help us unlock a very complex situation that is currently the nature in Gaza, of course. So as we are seeing, we are enabling humanitarian operations, which was our focus during the course of the conflict. We are now on the standards and oversight, making sure that we all work as a sector together to the same standards, making sure that we keep each other accountable, and that the early recovery support is the phase that we are now in and that we have now embarked. So why is prioritization critical? And I think this is a moment where we just have to stop very quickly, because we see that, globally we are all talking, over the last 3 days we've been discussing the scarcity of resources, the declining available funding for humanitarian mine action, and some of these challenges that we've all faced and that we've all seen and that we do recognize. In Gaza, of course, as in any other context, to make sure that we actually do the proper prioritization is critical. This means that first and foremost, we would start with any immediate life-saving intervention. Now, we can argue that any any action essentially addressing the explosive ordnance would be a life-saving intervention. But what do we mean with life-saving intervention? This means that we have a medical evacuation taking place right now. Our focus would be to make sure that that medical evacuation is able to deliver it. Secondly is, of course, the delivery of humanitarian aid. That would be the second priority area that we would definitely be supporting before we start moving on to early recovery initiatives such as debris management, access route opening, and so forth and so forth. You can see the different key criteria there on the thing. So once we have, of course, the confirmation of explosive ordnance or any EO accident, we try to capture that. We try to provide immediate mitigation advice, and we do that by, of course, directing the efforts into another area. So when we have a hazard on the left-hand side and we don't have a hazard on the right-hand side, then we try to encourage partners to go to the next one. There you can see some of the key things, that we have seen, that we have enabled as a mine action sector. And this is not only us as UNMAS, this is us and the entire sector with our partners working on the ground. It's around 225,000 tons of debris which have so far been collected, moved to debris management sites, and now being processed as we speak. This is a drop in the bucket of the debris that is scattered currently around Gaza. So it's going to be a lot of efforts to be leading on that. About 90 kilometers of roads has been assessed. These are some of the critical access routes across Gaza, which we have worked on and which we have supported our partners in opening, and just as recently as over the weekend. And then we have 212 debris management workers which have received explosive ordnance risk education. This means that these are the people directly engaged in the early recovery support and initiatives. During the course of the conflict, we have also delivered quite extensively explosive ordnance risk education to communities, helping them to mitigate the risks of explosive ordnance and also how to adopt safe behaviors while moving around these hazards and trying to mitigate them. That is the final point from my side, and I just want to thank you for your interest. I mean, just by being here today shows that we do have a lot of interest in Gaza. We do have a lot of supporting actors, and where you go out there and where you advocate and where you talk about Gaza, we ask that we all think about the people that we are here to serve, the people that are ultimately suffering due to explosive ordnance, and working together. And I think that comes back to the discussion. The main underlying theme in this discussion is that we need to work together. That's the only way that we'll be able to address this threat effectively. Thank you very much.
Thank you so much. I think it's really important to keep in mind and concentrate on what we can and cannot do. And I think that was a really great demonstration on what we can do. Everybody talking how restricted the environment is, which is restricted. However, I think it's important what we just showed and what Mr. van der Waal talked about, that there is still some possibilities, there are still good responses on the ground from the partners. And I think to move a bit further and dive into the discussion on the aspects of the EOD operations, I would invite Ms. Laubert to talk about challenges of the EOD operations on the ground. What are the possibilities? What are the key aspects of the Gaza operations from your perspective? You've been working in mine action for more than 8 years in different approaches, different contexts, different countries. So what are the specifics of the EOD operations in Gaza? Thank you.
Thank you, Katerina, and thank you, Julius. I think to answer your question, we need to have a closer look at what makes the Gaza context so specific. First off, on the explosive ordnance contamination. So what we're seeing in Gaza is a complex contamination, both in terms of the quantity of explosive ordnance, the type and variety of munitions. So in Gaza, it's primarily an exploded ordnance problem, with air drop weapons, artillery shells such as rockets and mortars, munitions from ground fighting, grenades, ammunitions. There's IEDs. There's, however, no reports of anti-personnel landmines being used in Gaza. What you see here on the right is a map that shows the estimated quantity of debris across Gaza. I think the last rapid damage and needs assessment that was published this week estimates that there are 68 million tons of debris across Gaza. And that's one of the main technical challenges that will actually come when we look at EOD and explosive ordnance contamination in Gaza, is that a majority of the explosive items will be buried under the rubble. So when we plan for an explosive ordnance disposal response, or EOD, we'll need to plan for a response that is at scale to these needs and to this damage, but is also linked to how the rubble removal and debris management process will progress in Gaza. Halo, so the Halo Trust, we've been in Gaza since January 2025. We have scaled up our response since November 2025 after the last ceasefire and the 20-point peace plan. And so in the last 6 months, we have deployed up to 14 EOD teams on rotation. And we have gathered lessons learned from activities in explosive hazard assessments and physical damage assessments. So these are visual surface-only assessments at this stage, but there are some technical considerations from these activities that will also apply to EOD operations in the future. So for example, in an urban context like Gaza, with the level of damage that we see here, we operate in a context where there's a lot of collapsed building or partially collapsed buildings. You see here on the right an example of a partially collapsed multi-story building. So for an example here, we're unable to access the different levels, or if a building has been completely flattened, then we have to do searching through a collapsed roof, which limits the level of assessments we can do. We also operate in an environment where the remaining structures can be fragile or at risk of collapse, which also limit the operations we can do, but we'll also have some actual technical consideration once we move to EOD, and I will get to that in a minute. While at the moment we're not doing positive action in terms of removing safe-to-move items or destroying items, these explosive hazard assessments have been a fundamental precursor for future EOD response. There will be, however, some technical consideration that will apply, that will be specific to the EOD phase in the future. So Julius mentioned the population density as a challenge in Gaza. And that will require careful planning when we move towards demolition, specifically on crowd control and how we keep people away and safe during a demolition. We mentioned already the fragile structures that remain and potential of collapse. Once we do demolitions, that will also require some thinking on how we can protect the surrounding area to protect them from blasts during a demolition. So for example, that will require some protective works. We can think about the use of traditional sandbags to limit the damage from a blast. But also at a larger scale, it could be pre-filled 1-ton sandbags with the use of machinery like excavators or cranes that will help to scale up that response. But there's also innovative approaches that we can look into, like water-based systems to further limit the impact of a blast. But we're not there yet in Gaza. And then, of course, further to these challenges is the limited equipment that we're able to bring into Gaza, and that will require for operators to adapt the EOD operations. This adaptation is not the job of operators alone, and this requires a collaboration effort, and there's active collaboration on the issue. There's frameworks and coordination mechanisms in particular that have been put in place in the last 6 months to advance these issues further. But on a technical level, it remains a rather standard EOD response, if I can say, specifically on the, in the sense of it won't require a high level of technology or innovation, but it will require to adapt how we think mine action and how we plan for a response that is both at scale and efficient. We will need to provide a response that is both timely and safe to support civilians who will restart to rebuild in Gaza, whether we are here or not as a sector, but also to support rubble removal and debris management in an early recovery phase. So this can be done, for example, by having teams that are ready to respond in a call-out response, again, in a timely and safe manner. But thinking outside the box on how we plan for at-scale mine action response, we can also embed EOD teams in rubble removal and debris management projects with the EOD teams doing visual search at the appropriate stages of debris clearance and recycling. It's worth noting that in Gaza, the rubble removal process will likely be done without armored machines, which makes that visual search step critical for the safety of debris operators and the whole operation. So with having that kind of response to be able to respond to a threat rapidly and support both civilians and humanitarian and early recovery efforts, we're not aiming necessarily to systematically survey and clear the whole of Gaza, but rather we as a sector need to act as an enabler for the humanitarian efforts and the early recovery response in Gaza. So what that means is EOD will need to be fully integrated in humanitarian efforts and early recovery programming. Mine action cannot operate in isolation in Gaza. There's 1.7 million people displaced with needs across sectors, from food, education, water, shelter, health, and with the facilities required for this response potentially contaminated with explosive ordnance. So we're talking about school buildings, medical facilities, road and access to hospitals, potential temporary shelter sites. So we need to have an EOD response that facilitate that humanitarian response and facilitate the early recovery phase. So on a final note, noting the funding landscape in international aid and how it's impacting the mine action community here, the type of response that we just described will not be possible if it's solely relying on traditional mine action funding mechanisms. It will need to be integrated and fully integrated from the start in the development of early recovery and reconstruction project design and project budgets, not only to ensure that the EOD element is funded, but also as a key strategy to manage the risks and to reduce the delays for debris management and reconstruction actions in Gaza, and in turn to ensure that the whole operation can be done safely and timely for the people of Gaza. Thank you.
Thank you so much. I think that's your last point was very important about the integration of mine action activities in the broader humanitarian response. And also, we discussed now technical aspects of the more specifically EOD operations, but I was wondering if EOD operations is enough when we are talking about mine action. So I would invite then now Mr. Darian to talk about the integrated approach. I know that HI was in Gaza for a long time and managed to implement EOD operations, victim assistance, EORE activities on the ground. So I wonder if you can share the practices, how the integrated approach works in practice, and also if you could look at the angle of the early recovery, how it would need to change to also respond on the early recovery needs.
Thank you very much, Katerina. Thank you very much, Julius and Ségolène. So in order to answer to your question, I will base myself on the experience of HI in the Gaza Strip specifically, as since October 2023, HI was able to deploy, I would say, like a comprehensive humanitarian mine action response early on in the conflict through quite a wide variety of means and modalities, and we're active on, I would say, like 3 main components, which are core of the HMA. First, EOD response, meaning de facto explosive hazard assessment, interagency mission, escort convoys, as well as explosive ordnance risk education and CPP response. Interpersonal sessions, of course, quick briefing, very important during massive movements of population during emergency, as well as safety briefing to humanitarians and mass media response. Especially as well through victim assistance, both specific efforts, meaning identification and referral of victims of explosive ordnance and other people in needs, as well as provision of services, MHPSS, rehabilitations, prosthetics, and orthotics. But beyond the fact that this response was both comprehensive and early on in the Gaza conflict, it was quite of an important scale, or I would say like a significant scale. Basically from October 2023 to December 2025, HI was able to conduct 80 HAs, reach more than 600,000 beneficiaries through direct EORE and CPP sessions, and reach out more than 1,000 NGO workers and relief workers with dedicated EORE and CPP safety training. Reach out more than 70,000 beneficiaries of rehabilitation and piano services, and more than 14,000 beneficiaries of MHPSS services. Why giving you these numbers would serve the presentation? It's basically highlighting and giving an idea that I would say that the good lesson learned or the added value of a comprehensive HMA response in emergency as well as in early recovery in a context as unprecedented as the Gaza Strip is based on a very, would say, significant operational sample. And therefore, I would say like the lessons applied here are quite, learned here are quite applicable elsewhere. So what are these added value of like a comprehensive HMA approach in emergency and early recovery? The first added value, it's such comprehensive multipolar intervention enabled an increased quality and efficiency of the overall intervention. So this is very textbook HMA and should not represent a massive innovation or it's not very complex, but basically even in a context such as Gaza, deploying all HMA pillars together, it allows the pillars to feed each other for better efficiency. On the EOD side, the operators, they are able to prioritize more accurately their operations, thanks to the information gathered during EORE and CPP sessions and the identifications and victims and accidents. On the EORE side, EORE CPP activities were better tailored to the explosive threat, considering the information provided by the EOD teams and the victims and accident data. And on the victim assistance side, the victim assistance services were much easier to access for the victims thanks to referral mechanisms starting from the EOD and the EORE CPP teams. And there was a specific focus on MHPSS in our response with the training of the EORE and CPP teams as well as community liaison officer deployed with the EOD teams in psychological first aid, as well as joint deployment to some extent in some projects of EORE teams with MHPSS staff. The second added value is that a comprehensive HMA facilitates community liaison and ensures that communities remain at the center of needs-based intervention, meaning that the integration of community liaison officers within the EOD teams ensured adequate culturally sensitive communication between the EOD teams and the communities, as well as real-time tailoring of the intervention to their needs. Indeed, among like the HI EOD teams, the CL was de facto directing the exchanges of the team with the community and was the face of the intervention to the communities, meaning that it was much beyond to have a translator, but rather someone understanding the community dynamics and trained to first explain the nature of the operation, second, gather communities' needs to tailor the EHA intervention, three, proactively link those needs with explosive ordnance risk education and victim assistance interventions. Beyond the CLO, de facto constant community liaison was ongoing with, through the EORE teams deployed on the ground, and that enabled the collection of key information on communities' vulnerabilities toward the explosive threats during EORE session, and I would say like liaison on the ground, discussion with the communities. The third added value is an increased capacity of risk management and application of the do no harm principle. Why? This was being done by enabling the EOD team to deliver emergency explosive ordnance risk education through the integration of EORE trained community liaison officers. So basically, when the EOD teams were intervening and they were facing beneficiaries in need now of explosive ordnance risk education, some personnel were able to do it at the moment, as well as the joint deployment of EORE and EOD teams for sensitive tasks necessitating the large-scale emergency risk education and crowd management. For instance, while marking an explosive ordnance into like a densely populated area, and when you would have I would say, control a potential crowd forming around a dangerous item. There was also the case of follow-up of sensitive EHAs by the EORE teams, ensuring adequate intervention to mitigate risk highlighted by the EOD teams. For instance, just to go back to the example of an unexploded ordnance that would be like marked into a densely populated area. In these specific cases, that would require a large-scale, relatively large-scale EORE intervention around this EHA and this item marked to ensure that the community is aware about the risk of the item specifically marked. And what are the lessons learned of this intervention for comprehensive HMA in emergency, but as well applicable in early recovery response? First, it's the positive results and clear added value on the ground. The second is that this approach was not too complex to operationalize, as comprehensive HMA can sometimes feel a bit like scary to a lot of us, but like it was basically just a matter, that's the third point, of linking together interventions that HI would de facto deploy on the ground that are already needed in an emergency setting that would continue in early recovery. We would deploy anyway EORE response. We would deploy anyway IHA. We would deploy anyway MHPSS, PNO, and rehab services. So it's just a matter of linking together existing things for an increased efficiency. And the fourth, comprehensive HMA allows a mine action intervention to remain people-centered and need-based. And that's especially important in an early recovery phase. Thank you.
Thank you so much, Glenn. I think the last point was very critical to reiterate for Gaza context when we are talking about the sensitivity around the context in general. And I think we unpacked quite well the EOD operations, and I think everybody can say how it's different because integrated approach used in many contexts, right? So I think it will be good now to talk about EORE and conflict preparedness protection to see what are the differences from one context to another and what are the specifics of the implementation of the EORE in Gaza specifically, especially when in the context when we have the early recovery stage to which link very much with the emergency. I would invite Colin, could you please talk more about the specifics of the explosive ordnance risk education, conflict preparedness protection in the early recovery angle for Gaza, considering that you've seen so many approaches and so many countries and the ways of the implementing this activity, so maybe you can talk about the specifics for Gaza. Thank you.
Yeah, absolutely. Really big pleasure to be here with you, and today I'm both representing Norwegian People's Aid, which has been working in some manner in Palestine since 1987, as well as I'm the co-chair for the Gaza EORE CPP Technical Working Group, co-chairing with UNMES. So I'm both on the coordination side and on the implementation side. As we've heard so far, Gaza is an extremely challenging context to be operating in, because of the urban nature of the contamination, as well as the mass displacement, which has left an estimated 1.9 million Palestinians particularly exposed and vulnerable to explosive ordnance risks in their daily lives because of displacement. Rubble clearance and reconstruction efforts are proceeding despite the absence of effective EOD clearance operations, meaning that debris workers and returnees are very much at risk and that recovery efforts are impeded. Contamination of economically productive land also impedes agriculture and hence impacts Gaza's food supply and the economy. While the ceasefire has provided a more stable environment, which is more conducive to recovery efforts, attacks involving the use of explosive weapons in populated areas continue, and these continue to pose a unique danger to civilians who are trying to live their lives now and recover from the conflict. This means that pairing explosive ordnance risk education with conflict preparedness and protection risk education is really key and remains key moving forward, given the continued risk of escalation and perhaps renewed conflict should the ceasefire break down. EORE and CPB have been an important part of early recovery since the announcement of the ceasefire last year in a number of ways. first and primarily, our aim is to help prevent civilian casualties through improved public awareness and safer behavior. And this, of course, has a tremendous impact on how Gaza is recovering and that it can get past what has happened over the last 2 years. EORE enables safer rubble removal and reconstruction efforts, as well as safer use of economically significant land and property. EORE and CPP for humanitarian workers enables safer delivery of aid. EORE and CPP operations, as we deploy facilitators into communities, also assists in the implementation of other mine action activities. So the more that we're out into communities with EORE and CPP facilitators, the more explosive ordnance hazard and incident reporting we're receiving to the cluster, to the AOR, the more explosive hazard assessment requests we're receiving, and the more victim reports and referrals we're able to receive as well. All of this helps with service provision and enables a more robust humanitarian mine action response overall. Continuous EORE and CPP outreach is really key, more important than ever, because this is a protracted conflict where clearance is not possible at the moment at scale. And so we can't simply see explosive ordnance risk education as a stopgap measure, something that we do until the clearance happens. There's no clear path forward for that. So we need to have a different idea of risk education in this highly constrained humanitarian space, one where we need to be continuously implementing and adapting our approaches so that we're maintaining the dissemination of safety messaging. Last, as I mentioned, CPP is key because these attacks with explosive weapons are continuing, unfortunately, and communities need to be made more resilient against these attacks. The more resilience we can promote, the faster communities are able to bounce back from the devastating last few years of conflict. Mine action operators are trying to reach these outcomes via both interpersonal sessions and mass media approaches. We have quite a number of operators deploying risk education facilitators across the Gaza Strip, as well as the West Bank, of course. Over the previous year, nearly 100,000 EORE CPP sessions were conducted in the Gaza Strip for over 1.5 million beneficiaries in Gaza. Mass media campaigns have been a continuous effort. Mass media was an extremely important methodology or approach during the emergency, especially when access was restricted and we needed to reach people in every single way that we could in order to get the message out when it was most important. Now, these messages, these approaches remain particularly important. We're now able to use radio more, now that radio is more operational. Podcasts, materials distribution is easier now with increased access. Billboards and murals are going up in communities, so we see more and more work being done to raise awareness through mass media. Integration is much more difficult in an emergency situation than in early recovery. So now the ceasefire situation allows us to have greater integration of EORE and CPP activities with other forms of humanitarian assistance. So we've been able to pair explosive ordnance risk education and CPP sessions and outreach with explosive hazard assessments, with child protection through the training up of child protection focal points who are able to deliver this safety messaging when doing case management. We've obviously through mine action, we're trying to mitigate the harm caused by the physical harm caused by explosive weapons and explosive ordnance, but mental health and psychological support are key to mitigating the mental and psychological damage caused by these weapons in this conflict. So integrating our messaging into those activities and supporting actors that are doing them is really critical. Site management, with so many people displaced, integrating EORE and CPP into site management is key, as well as sexual and gender-based violence outreach, protection outreach, as well as food security and livelihoods. A big key part of the success of the EORE CPP sector in Gaza has been coordination, which has been under the Gaza EORE CPP Technical Working Group since immediately after the beginning of the conflict. This technical working group has seen a very active membership, all coming together to contribute to a kind of joint effort to develop safety messaging approaches, guidance, training packages. We're sharing materials and messages, standardizing those messages together, and workshopping together on making sure that EORE and CPP efforts are conducted efficiently and effectively. A really big key part of this coordination has been the setup of a robust information management system, whereby right from the get-go at the beginning of the conflict, we were able to bring in as much data as we could from operators and have a clear picture of where explosive ordnance risk education is taking place in Gaza and avoid duplication that way. I wanted to finish up with two quotes, but I think in the interest of time, I'll just say one quote. Last year, we were interviewing our partner teams and getting interesting stories from them about the impact of their work and their experiences as EORE CPP facilitators. And one that I wanted to highlight just because I think it's a good indicator of what EORE is out there to accomplish is a story by a facilitator named Asma, who was recounting a story about how she had deployed in order to conduct a training for a group of women, I think in Khan Yunis. And she says, upon arriving at the training location, I introduced the activities and warned the mothers. It was never easy to focus while we were under heavy bombardment around us, but I remained committed to our mission. After I finished and left the area, it was bombed. Thankfully, I had gone and shared the information I had, and as I later met one of the mothers who told me how a rocket had fallen but did not explode. The women began shouting for everyone to remember what they had learned in the session. They acted quickly, moving away until the authorities could address the ordnance. Thankfully, no one was harmed. So it's really critical that we are out in these communities meeting with average people whose lives are very difficult right now, making sure that they have the information that they need in order to stay safe, practice safer behavior, and are able to bounce back from this very troubling time. Thank you.
Thank you so much, Colin. And yeah, I think what I'm forgetting, being privileged working for Action EOR, and I'm working with these people every day, that they supporting each of them, the technical working groups. And I completely forgot to mention that Colin been chairing the technical working group already for 2 years. And the HI, together with DRC, have been co-chairing the Victim Assistance Technical Working Group, and Hello Trust with UNMA has been co-chairing EOD Technical Working Group. And the support we've got from each specialist was amazing, excellent. And that's why probably we came up with all these brilliant ideas and immediate response and prioritization tools and IAM system in place. So that's why I think when we are talking about Gaza is a good approach, when we are talking about integrated approach, it's because of all the people on the panel and in this room. So I think what we uncovered is the approach we are using for the EOD operations. We discussed the integration of the mine action operations in the early recovery framework. We now discuss and dive more into details about EORE CPP activities on the ground. And one last pillar which is very important and often forgotten, I think, and neglected, is victim assistance. So I would invite Nick to talk about victim assistance in Gaza. I know you from Ukraine, and you've been in Mine Action for more than 10 years by now. And also, I do remember how you brought up the victim assistance in Ukraine, and that's how the entire victim assistance support in Ukraine started to develop, and the technical working group started to develop, and then you brought it to Gaza as well. So I think victim assistance is not easy to implement in emergency context, and especially in the context like Gaza. So maybe you could talk more about the specifics of the implementation of the victim assistance in Gaza, what we able as a sector to achieve, and also touch base about the early recovery angle. Would that change in the early recovery perspective from your opinion? Thank you.
Perfect. Thank you very much for your kind words and for your questions. So let me first talk a little bit about the victims of explosive weapons in the Strip. We have, as you have seen from my colleague's presentation, about 1,000 victims reported in the centralized database at the moment, but I believe we will all here agree that that is a massive underestimate. The DRC has recently conducted a household assessment in the displacement sites that we manage, uncovering 700 victims that are not yet reported in the database itself. And then we also know of 170,000 people who have been injured during the course of this war, perhaps not all from explosive blast, but we do believe a large percentage of them likely. And as you have seen also from previous presentations, all of the destruction that Gaza sits in. We have to imagine that the destroyed buildings that you have seen on the pictures used to be hospitals, they used to be schools, they used to be the private sector, and now that is absolutely destroyed. And it is against this context that victim assistance has to find support for victims of explosive ordnance. Now, while the situation is certainly dire, that does not mean that it was impossible to do victim assistance. And I think victim assistance in Gaza and elsewhere really is a testament of integration. It's integrated internally in organizations, it's integrated between different organizations, and then it's integrated also with the other clusters of humanitarian aid. And so we have great examples here on that. First and foremost, every single organization here reports identified victims to the centralized database that was set up by UNMAS. And without that, we could not continue with support. And then there is a direct link between the UNMAS database with DRC for all adult victims and with the Child Protection AOR for all child victims of explosive ordnance. And then there's direct links between DRC and other mine action operators when it comes to the provision of services. We have a great collaboration with HI on prosthetics and orthotics, for example. And so this is how we were still able to support over 200 victims of explosive weapons thus far, both with cash grants and with referrals to 5 different humanitarian sectors. Then coordination is another avenue where integration comes across. As has been mentioned, DRC and HI co-chair the Victim Assistance Technical Working Group. It includes all mine action operators, but it also includes all organizations, many organizations from other sectors as well. From protection, from health, from shelter, from MPCA, and so on and so forth. And this has also enabled the Victim Assistance Technical Working Group to be more efficient when it comes to mapping of services. We don't have to map all the services of our own. We can go to the health sector and they can share their mapping, and we can go to the protection shelter, protection cluster, and they can give us their mapping. And we bring all of that together to eventually put a directory of services together. Now let's look just quickly at the demographic information about the victims themselves. DRC recently issued a report on the 100 victims of explosive ordnance that we supported. There is a few copies still left over here if anybody's interested afterwards. They've been conducted by medical doctors that work in DRC. They are predominantly male, as you can see, 83% of them, in fact, are male, and mainly reflect adults of working age, okay? So they're around 36 years of age. Keep in mind, the assessment is done on adult victims. That's not to say that from all victims, 36 would be the average age. Child victims are also a separate category over here. Now, most of the victims here have been injured by explosive ordnance, 70%, followed by those who have been injured by the use of explosive weapons in populated areas, at 23%, and then 8% for small arms and light weapons. Keep in mind that the data requirement for the centralized database is to report EO victims. So predominantly, you would be imagining EO victims coming out of the database. That's not to say that there's not a lot more of victims of explosive weapons in populated areas out there. Keep also in mind that around 10% of the victims, in fact, got injured multiple times over the course since the war has started. We have a case, for example, of an injury with an explosive ordnance at the beginning, and a couple of months later, they got injured by active shelling falling on them, and then they got shot twice in 2 different occasions in the coming months as well, trying to get food, for example, and so on and so forth. The same person got injured 4 times over the course of 2 years, and around 10% out of 100 are like that. They will mostly live in Deir al-Balah, Gaza, and Khan Yunis governorates, as you can see, but those are not the areas that are affected by explosive ordnance. Victims move in any context, but they have also moved massively in Gaza. In a different study by DRC, on average, a resident of the Gaza Strip has been displaced forcibly 11 times. So 11 times in 2 years, people have been displaced on average. We've had individuals displaced up to 30 times over the 2 years. The consequences of injury are inherently multi-sectoral, okay? They range from medical needs, protection needs, shelter needs, cash needs. Every victim will have a different variety of this. Around 70% would have needs from 2 sectors, about 50% will have 3 or more sectorial needs, okay? Today we will focus for this presentation only on the livelihoods needs specifically. Keep in mind, for example, 90% of the victims that we have worked with have lost their job because of the injury. Of those, 70% can no longer return to any work at all because of how severe the injury is, okay? Around a quarter have lost their role as a breadwinner in their families. And on the other hand, we have a large percentage of victims who have to pay out of pocket to receive the services. They have to pay for the painkillers because there's nowhere else to get them. They have to pay for the transport because it's incredibly expensive with fuel being so low, with market dysfunctionality in the Strip as well. So many resort to extreme negative coping mechanisms. They start selling off their assets. There's cases where people have before managed a cafeteria and then had to sell the cafeteria to be able to afford painkillers, right? So it's very clear that injury from explosive weapons is also a direct driver of household economic collapse in the Strip. Now, victims, in fact, are able to recover in the way that it's possible. They are incredibly creative and resilient in the Strip when it comes to this. DRC provides them with cash grant because of the characteristics that we've seen before. Many, for example, like Ahmed here on the picture, were able to buy food supply and started a food stall where they then sell this food onwards. Many, for example, bought computers that have been destroyed during the war to either rejoin studies or because they were graphic designers before. They bought cameras that they have lost during the war to continue their work as photographers. So injured people are able to return. They're very keen to return, and they are able to be very creative in how they return into the economic sphere. And on top of that, it's very much needed that they receive also referrals from other sectors. It's not just cash. It will not be enough, but it is, in DRC's experience, a big prerequisite to start with cash. But receiving referrals to health sector, protection, MPCA services has been a crucial part also of their overall recovery process. For the final sort of words and what are the key priorities for victim assistance, in Gaza and in early recovery specifically. We need to start supporting victims because they are a core entry point to recovery. Economies run on people, okay? Without people, no business works, no market works, and so if people are not active in the economy, then nothing economic comes out of society. We need to support explosive weapons victims earlier also because it drives household economies downwards, right? People lose their breadwinner potential and so on and so forth. Even before October 2023, 20% of people in Gaza were exhibiting some sort of a disability, okay? That was before October 2023. Now we have a massive percentage of people who have got injured additionally. So any kind of early recovery efforts, they must be disability inclusive by design, because a third of the workforce likely will have some sort of a disability. And then finally, because of these multi-sectoral needs, of the victims of explosive ordnance, victim assistance cannot be siloed. It cannot only be a mine action activity. It has to be integrated with other clusters between operators of mine action as well. So that's it from my side as well. Thank you very much.
Thank you so much, Nick. And I think we have still 5 minutes for questions, and I would encourage everyone to use this opportunity to ask our panelists to discuss one or another topic where they are specialized. Any questions? Please.
Thank you to all the panelists today. It was a fantastic presentation from everyone. Shane Clancy from ICRC. Question specifically aimed at HI, NPA and DFC. With regards to your registration clearly in Israel and the occupied territories, I can only imagine the constraints that's now kind of placed on you to oversee your programs at reach. I was just wondering if you'd like to tell us a bit more about how you guys are managing that.
Who would like to come in on that? Glenn or Nick?
I can take a stab at it at the beginning. Yeah, it's a tough question. Obviously, there's a lot of unknowns right now. As I said before, NPA has been a long time actor in Palestine and particularly in the Gaza Strip. Our main office, our country office, was based in the Gaza Strip for many years until this conflict. The conflict forced us to move our kind of center of gravity for management, admin, finance to Amman, but we maintained our ability to deploy staff in Gaza, but that experience over several decades. We're a partnership-based organization. NPA is very much partnership-based, and we have, over the years, developed a very wide network of civil society actors, partners who are embedded in these communities, who are trusted, and who we support, and we provide capacity development support so they can deliver assistance, including explosive ordnance risk education, CPP, etc. So we're continuing to work with those local partners. I think that is perhaps the modality right now moving forward for us until we have more clarity on the registration issue. Thanks.
Thank you. I don't know, Julius, if you would like maybe to add to that about also modalities we introduce in, not for only EORE and victim assistance, but also for the EOD operations?
Yeah, thank you very much. So from our side, as UNMAS, we are also trying to see how we can support our partners. In that, we have also recently discussed with certain of our partners how to embed, as I've mentioned during the briefing a little bit earlier, how to embed some of their personnel within our structures. So therefore, also as UNMAS, we are trying to facilitate the entry of our partners in terms of collaborating with them, to have their staff with us, working alongside, and making sure that we ultimately work together as a sector. And not in isolation. So that's all I can add really, is how we're all trying to just collaborate and make sure that there's a joint approach and that we make the best. As we've mentioned, there's a severe limitation around resources globally, and we want to make sure that available resources are actually utilized and not remain dormant. Thank you.
Thank you. I've seen another, Daniel, please. I've seen another question as well. So we have 2 more questions, right? Who would like to? Then please.
Thank you. First of all, I'd like to appreciate all of you for your work in Palestine. I work at the Mission of Palestine here in Geneva, and your role is very essential. And as you all know, we want to work and collaborate with all international organizations that work in Palestine. But I would like to know more from you about now the division of Gaza by many partners, since there's a red zone and the green zone and the yellow line. How is that impacting your work, especially that there are already constraints on letting the technical support in? So, thank you.
Thank you. Who would like to come in on that?
Thank you. And I think that's particularly relevant in terms of EHA and EOD activities as well, as we progress towards that. So at the moment, we as a sector operate under UN framework and under tasking and prioritization for en masse in the red zone area, where 98% of the population of Gaza lives. And it's really crucial that our work is not only benefiting Palestinians, but also seen as benefiting Palestinians. But obviously, as a sector, ideally would like to work across Gaza in a unified framework for the benefit of these Palestinians. So, Julius, if you want to add to that.
Yeah, thank you very much. I think, as you've mentioned, thank you very much for raising that question. It's, when it comes to Gaza, we all recognize it's a single entity as part of the broader OPT. So in that, there's no division that's being recognized in terms of political aspects in that regard. It's all recognized as one territory. But we do understand that there are certain pragmatic challenges on the ground. If we compare, for instance, how to operate in the West Bank, to how to operate on the one part of Gaza, let's say to the west of the so-called yellow line, as you've referenced to, and the east of the so-called yellow line. These are all different ways of how we coordinate. For us, it's very much as humanitarian mine action, and I think we all speak together, it's where the needs are. It's all needs-driven, prioritized in that. And as I've mentioned earlier, it's where the people are. It is so, as you've mentioned, that the majority of the population is currently concentrated to the west of the so-called yellow line. That also means that the majority of the interventions are being focused on the west of the yellow line. But there are also activities. There's joint missions. I'll just grab one. I saw my colleague from UNICEF just leave the room. But there was a recent mission, for instance, which is one of several examples where UNICEF assessed a wastewater rehabilitation plant down in Rafah area, and that was an interagency mission. It had to cross over the so-called yellow line, and therefore UNMAS, as well as our partners, were there supporting that initiative, providing the necessary support. So for us, where the needs are, we are there. Mine action is embedded, irrespective of where it is. Thank you.
Thank you so much. I think we unfortunately ran out of time. So I would like to thank our panelists today for the insightful discussion. And I would like to thank everyone who joined us today, and safe return home, because I believe everyone will be today leaving or tomorrow. So safe travels, and thank you very much.